My mum has dementia. Does she qualify for continuing healthcare funding? If your mum has dementia, you may be wondering if she qualifies for NHS Continuing Healthcare (CHC) funding. Let's break it down in simple terms. CHC is non-means tested funding provided by the NHS for people with significant healthcare needs, covering care home fees, nursing care, or even care at home. However, dementia alone does not automatically qualify someone for CHC. The key factor is the level and complexity of their needs. A multidisciplinary team of health professionals will assess your mum's care plan, daily care needs, and the nature, complexity, intensity, and unpredictability of her condition to determine whether her needs are primarily health-based rather than social care needs. If her needs are severe and ongoing, she may qualify for full CHC funding. If not, she might still receive NHS-funded nursing care to help with some costs in a care home. To check eligibility, you can ask your GP, social worker, nursing home, or community nurses for a CHC assessment. It's important to understand the difference between CHC funding and local authority funding. CHC is fully funded by the NHS and is based on nature, the overall characteristics of your mum's needs and how they impact her care. Complexity, how her different health conditions interact and require specialist care. Intensity, the severity and frequency of care required. Unpredictability, how unstable or fluctuating is her condition and the risk of sudden deterioration. In contrast, local authority funding is means-tested, provided by the Council for Social Care Needs, like help with washing, dressing, and eating. If your savings exceed £23,250 in England, you may have to cover care costs yourself. If CHC funding is refused, you have options. First, request a copy of the decision and assessment to understand how they evaluated your mum's needs. Check the eligibility criteria, gather medical records, care home reports, GP letters, and other evidence to support your case. You have the right to challenge the decision and request a review. Seeking independent advice from advocacy groups, legal advisors, or charities can also be helpful. The process can feel overwhelming, but you are not alone. Please share your experience in the comments.